My name is Charles Adjei. I am the former administrator of Pantang Psychiatric Hospital in Ghana. I've worked in that mental hospital for 13 good years. I am a professional administrator and have my training in the University of Ghana. I have a first degree in hospital management. And I have a second degree in the United Kingdom, which is Masters in Planning, Policy, and Management of Health Services. My duties as the hospital administrator is to implement government policies on mental health. Secondly, I am to provide or to ensure that there is sound and effective financial management, including resource management of the hospital. I also coordinate, prepare action plans, set objectives, monitor and evaluate the performance of the hospital. I play supervisory role in non-clinical areas such as the estate, security, housekeeping and domestic, environmental, and human resource. There are officers in charge of these departments, but I play a supervisory role over these officers. The Pantang Hospital is a 400-bed hospital. That was how it was built. But now, the bed complement has been reduced to 180 beds. It has a staff strength of 800. It provides outpatient and inpatient services. It provides a rehabilitation center. That is those who need rehabilitation. We have the acute wards where patients who are acutely ill are kept. Then we have those who come to the hospital and have been there for so long. They are chronic patients. Some have been on admission for more than 10 years. The patients' relatives have abandoned them, and for that matter, they have nowhere to go. The short history of Pantang Hospital. I will generally talk about the mental health service delivery in Ghana. The first mental hospital was established in the year 1900. That's 1900. I operated like it is a prison, just like prison. Patients are just put there restrained. But with time, 2 other hospitals were constructed. That is the Pantang Hospital in Accra, and another one, which is we call it Ankafo Hospital. That's also a psychiatric hospital in Cape Coast. The Pantang Hospital has been established in the year 1975. There are various categories of staff there. We have the psychiatrist. There are 6 psychiatrists at the moment. There are 2 clinical psychologists. There's occupational therapist manning the occupational department. There are 3 resident psychiatrists. They are in training, and when they complete, they will join the staff complement. Psychiatric hospitals or psychiatric health services are in the past institutional based. They are delivered in the hospitals. This has created a problem of accessibility. Now things have changed, and the government of Ghana has introduced the community psychiatric health services. It is expanding this area of health or mental health delivery so that many patients could have easy access to the services. Patients could be treated in their homes, and that will also reduce the cost of treatment. The problems faced in the mental health service in Ghana, in Pantang Hospital in particular, is lack of awareness and stigmatization. The general public lack an insight into what mental health is. So they think mental health is caused by cultural factors such as witchcraft, somebody who have committed crime somewhere, and then the effect can be diseases such as mental health. So people don't have any passion. People are not compassionate. They are not compassionate about mental health. They think it is the fault of the patients. Some think because the patient are taking drugs or substance abuse, is the patient's making. So people don't have compassion on these kind of patients. Secondly, the problem of access is very, very, very pronounced. Many patients do not have access. Patients that need mental health services do not have access. The problem with the access is that government services, mental health services are supposed to be free of charge. But in reality, mental health patients have to pay. They pay huge sums of money before they can access the mental health services. For example, at the moment, if somebody is to be on admission, a mental health patient is to be on admission at the Pantang Hospital, he has to pay 7,000 Ghana cedis, which is equivalent to £600 a month. On monthly basis, the patient had to pay £600, and that money is meant to keep that, just like a maintenance fee, just for the maintenance or the upkeep of the patient in the hospital there. The problem is that if you look at the incomes of the people in Ghana here, they cannot afford such a huge amount of money on a monthly basis. So when they have relatives who need mental health care, they rather go to the spiritualist, the herbalist, the pastors for prayers. because they are not able to afford clients. If a patient has to spend about 2-3 months in the hospital, it's impossible because the relatives cannot afford the £600 per month for 3 months or for a long period. Then we have the problem of medication. Medicines, psychotropic drugs are not available at all. Patients have to pay for them. The problem is, how do the patient get money to pay? They don't have money to pay. Even in most cases, the drugs or the medications are not even available in the facilities. So it has become a problem. So lack of medication is a problem, big major problem in the hospitals. Then apart from the problem, apart from the financial accessibility, we have geographical access, which is also a problem. The geographical access is that there are very few health facilities. Ghana has a population of 33 million people. There are only 3 mental health hospitals, all located in the southern part of the country. So patients requiring referrals, some have to travel 800 kilometers to access the mental hospital. Some have to travel as long as 400 kilometers, some 200 kilometers. Imagine traveling with a mental patient for such a distance and you don't have the right transport. You just have to come with a patient in a public transport. So because of that, many patients just don't have access. The public do not have access to mental health services. The government has plans to build some mental health facilities and also integrate the mental health services with the general hospitals. The problem is the psychiatrists and the personnel, but work is in progress. We hope that one day we will reach there. Because of lack of money, some patients cannot come to the mental hospital at all because they don't have transport. They don't have money to pay for the cost of transport. So because of that, they refuse to come.